Hey guys, this is Dr. Hub. Today we are looking at the nerve injuries based on the seddon's classification. So the seddon's classification, it is divided into three types. So let's write it. That is the neuropraxia. So first one is the neuropraxia. Secondly, there is the axonotmesis. Axonotmesis. Then thirdly, there is the neurotmesis. Neurotmesis. Now let's break each of them down. So first we are going to talk about the neuropraxia. So neuropraxia. So neuropraxia, it is nothing but a reversible physiological conduction block. So it is a physiological. It is a reversible. So this is very important. Reversible. It is a reversible physiologic conduction block. It is a reversible physiologic conduction block. And other thing is, it occurs due to the mechanical pressure causing the segmental demyelination. So it occurs due to the mechanical pressure. So there will be mechanical pressure which causes the segmental demyelination. So there is the segmental demyelination which is present. So what are the examples in terms of the neuropraxia? The examples it includes, there's a Saturday night palsy. There's a Saturday night palsy, we are writing it as NP. And there is also the tourniquet. And also the crutch palsy. There is also the presence of the crutch palsy. Then we move on to the axonotmesis. So in terms of the axonotmesis, so here there is an axonal interruption. So as the name suggests, it is nothing but an axonal. There is an axonal interruption, and there is also conduction is lost. So there is the conduction which is lost. So conduction is lost, but the nerve is in continuity. So the conduction is lost, but the nerve is in continuity, and the neural tubes are intact. So the neural tubes, they are intact. So what are the examples in terms of this category? The examples is, there is a closed fractures and the dislocations. So in terms of the closed fractures as well as the dislocations. Then lastly we move on to the neurotmesis. So it is the neurotmesis. So in this case of neurotmesis, there is a division of the nerve trunk. There is division of the NT, that is a nerve trunk. And looking at the endoneural tube destruction, it also occurs. So there is a endoneural destruction, endoneural tube destruction which occurs. And example here is, so this is very severe form, that is the example of the complete section of the nerve in terms of the open fractures. So closed fractures means it is axonotmesis, and neurotmesis is the complete, it is a complete section of the nerve. Complete section of nerve in terms of the open fractures, in terms of the open fractures. To learn and grow daily like this, please do subscribe.